Hey guys, welcome back. So today I'm going to do something a little bit different. I'm not going to do any full face makeups or anything like that, and as you can see, I'm not really wearing any makeup right now. I'm going to speak to you a little bit more about skincare. I know we have that first video that I did a few months back, or maybe even last year, in regards to prepping the skin. I'm going to be a little bit more specific in terms of this particular skincare video. So I'm going to focus a little bit more on uneven skin tone or hyperpigmentation on the skin, due from either post-acne scarring or any sun damage or anything like that. So I'm just going to speak to the correct regimen that you should be having, and also some treatments that you can also use to not only prevent hyperpigmentation, but also restore a little bit more of that clarity and that even tone throughout the skin to really break up that hyperpigmentation and that or that over melanin production, or that overproduction of melanin in the skin, excuse me. So I'm going to start off with just obviously the basics. The first step to every skincare routine is super clean skin. So you want to make sure that you're getting the best clean possible. Personally, I'll show you a couple of products as well. I use the Korres, the yogurt cleanser, and it's really great because it's a nice foaming, creamy cleanser. It removes all types of stuff like dirt, grime, basically makeup, everything. It really melts everything down, and it's meant for all skin types. And what's really great about this particular cleanser, excuse me, is it doesn't have any sulfates in it. So what sulfates basically end up being are detergents. Detergents can definitely strip the skin very, very badly. It can cause dryness on the skin, irritation. So it just really depends on your sensitivity or irritation level on the skin. Now, in conjunction to this, I use this with a cleansing device or a cleansing tool. Personally, I've used two different kinds. There is, I should say, the Clarisonic. This is a really great device because it gives you 4 times better clean than just using your hands by itself, excuse me, and it has that Clarisonic technology, or the Sonic Care technology in there. So it's got little brush heads, and when you turn it off, it actually oscillates, and it has a vibration. You don't press very hard with this guy. You just kind of really let the brush do what it does, basically let it do its job, and it really helps to shake out all this extra dirt and grime that's locked into the skin. I always give my little story that when I first used a Clarisonic, I wasn't really a true believer in it. And by the way, they're the same brand that does the Sonic Care toothbrush as well. Side note. But I was saying I wasn't really a true believer in the Clarisonic until I basically used it myself. I cleansed my skin like I normally do with my hands. I had a full face makeup on, and it felt good. And then I went in and I used my Clarisonic with a little bit more cleanser, and sure enough, on that brush head, it was a ton of foundation left on it. So it kind of irked me and kind of made me a little bit more sketchy as to basically I wasn't cleaning my face right for 20 some odd years. So yeah, so that's definitely a really great tool to use, especially if you want that deeper clean. It is not an exfoliator. You still need to exfoliate the skin on a regular basis, 2 to 3 times a week, with a really nice exfoliating product. The second tool that I like using for a deeper clean is the Foreo. They have 2 different versions. They have the full size, just like this guy, and then they have a little travel size called the Luna, or the Mini Luna. And this is really great because you don't have any brushes to basically buy. So everything is basically just here. You plug it in, you charge it, and you just use it straight on the skin with a little bit of cleanser. And this is really great for a person who has a little bit more of that sensitive skin, or just travels a lot and doesn't want to deal with, traveling with brush heads and a big, huge component like the other one. So this is definitely a great tool to use to give you that deeper clean as well. Very similar to the Clarisonic. It'll give you that deeper clean without exfoliating or overly irritating the skin, which is really great. Now, like I was mentioning before, you want to definitely exfoliate. The Clarisonic or the Foreo does not take place of your exfoliator. So personally, what I like to use is more of a chemical exfoliation. Dr. Dennis Gross has these amazing alpha beta peels that you can use on a daily basis. Very low grade acids in there, so it's not super like burning or anything like that, which is really great. Personally, I can't use them on an everyday basis. They're just a little bit too much for my skin, so I like to just kind of use them about 4 to 5 times a week, and they look something like this. They come in pre-packaged little paquettes, which is really great, especially if you travel quite a bit. And it's super easy. Cleanse the skin, pat dry, run the first saturated towelette all throughout your skin, and then let that sit for about 2 minutes. and then you grab that second step, grab that towelette everywhere you have put that first step, and it basically neutralizes it. It stops the activation from the first acid peel, or the first step in the acid peel. And you're just left with really nice smooth skin. Besides exfoliating the skin, these have really great properties to them. So it's really great for fine lines, wrinkles, firming the skin, smoothing texture, decongesting the skin. So if you're prone to blackheads, whiteheads, or acne, it'll help to dry up the acne. It'll help to keep those pores clean with a little bit of the salicylic that's in here as well. And it's just a really great way to really just smooth out your texture and just really get a really nice radiant look to the skin without being super abrasive, which is really nice. They do come in a universal. They come in extra strength, these guys, and I believe they're coming out with a sensitive one as well. So if you do feel like you're quite sensitive and you still don't feel like the universal is quite sensitive enough for you, then there'll be one for you as well. So with that said, we're going to start going straight into our treatment step. So once we've cleansed and we've exfoliated, because you definitely want all that extra skin off the surface of the face so that your treatments will actually penetrate into the skin deeper and get your skin going on a more cellular level, right? I'm going to show you two different products that I personally use, and then I'll go through other ingredients that you can also use to brighten the skin as well. Some are a little bit more abrasive. Some are just a little bit more botanical based, a little bit more geared for a sensitive skin, or if you are a sunbather and you like to sunbathe. So personally, I like to use a vitamin C serum. Vitamin C is very well known for its brightening properties, for its collagen boosting properties, and also giving you that really nice radiant glow. And not only a glow, but it'll help to really break up a lot of that hyperpigmentation on the surface of the skin or underneath the skin. So what's really great is actually, and this is not a joke, they call vitamin C the BLT of skincare, not bacon, lettuce, and tomato. It stands for brighten, lighten, and tighten. So again, collagen boosting, lightening of that hyperpigmentation, and giving you that overall glow through the skin. So if you feel like you have dullness as well, this is a really great product for you, or a really good ingredient for you. Just make sure that you're testing it so it doesn't give you any kind of sensitivity, because it can be sometimes a little harsh, and it just depends on your skin and what your skin likes, basically. So I'll show you my daytime vitamin C serum. It's the Algenist Genius Ultimate Aging Vitamin C Serum. So again, it's going to help to brighten, it's going to help to really tighten the skin or boost that collagen in the skin a little bit more, keep everything where it is. And it's going to help to give me that really nice glow. It doesn't give me, and it's by the way, this particular formulation is a stabilized vitamin C, so it doesn't give you any irritation, which is really great. So I generally use this, well, you want to use this underneath your moisturizer before you put anything on the skin. Your treatments always go on before anything on the skin. You want to ensure that there's nothing in between your actual treatment step and your skin. What's really great about serums is the serums tend to be a lot higher in terms of percentages and in terms of their active ingredients. So it's going to give you a little bit more to work off of than just a moisturizer. It's also the molecule's a lot smaller, so it penetrates a lot deeper into the skin. So it's going to give you that, it's basically going to go deeper and it's going to rev your skin up really, really nicely. So what I always tell people, or if they ask for my advice, is they'll always ask, so which one should I go for, a moisturizer or a treatment? Really just depends on your preference. But if you have a true concern, a main concern that you want to fix, I would always go serum. Serum is going to be your best friend because, again, higher percentage of active ingredients, and it's going to penetrate a lot deeper into the skin to get your skin going from within. All right, so nighttime, I use more of a nighttime treatment, obviously. It's a Kate Somerville Mega C. It's a brightening serum as well. This one has a double pump kind of thing going on. So if you look at it, it's got the two little chambers there. One side's a vitamin C, and it's a 10% vitamin C, so it's very strong. And this is why it's meant for nighttime use only, so it doesn't give you any irritation or sun sensitivity. And then the second step in that, or in that second vial or in that second tube, is more of a buffer, omegas, peptides, things of that nature. So it's going to keep that firming aspect of the vitamin C, kind of piggyback off of that, give you a little bit more hydration, and it actually helps to buffer that vitamin C so it doesn't give you any irritation as well, which is really great. So besides vitamin C, there's other there's other products that definitely brighten the skin. One of the ingredients that are used a lot in doctor formulated brighteners or lighteners for the skin is hydroquinone. Hydroquinone is a very abrasive chemical. Over the counter, I believe, you'll only find about 2%. I haven't seen anything higher than that. Everything higher than that is usually meant to be prescribed to you by a dermatologist. So you want to be really careful with that particular ingredient, only because you are not to wear that at all during the day, at all whatsoever, because it can give you a lot of photosensitivity. It can burn the skin. It can give you more hyperpigmentation on the skin, so it can be a little bit more counterproductive than anything else. So it's only meant as a night treatment only. Now for the summertime, if you like to sunbathe, if you like to be outdoors, it's not something that I would recommend for you at this particular season. Maybe if you stay indoors a little bit more towards the fall and winter, maybe you'd like to pick that up. Also, you want to make sure that you're only using it for a 3-month span. You can usually only use it for 3 months, then stop for another 3 months or so, and then continue on for the next 3 months. And usually you'll see quite a bit of a significant change in your hyperpigmentation. But again, that chemical is just a little bit more abrasive on the skin. So you want to watch out for that and want to make sure that you're not going to be out in the sun or anything like that. Another product that has a little bit more of a brightener, I don't have it with me, it's not something that I own, unfortunately, is Totale. Totale has a serum, it's called Vino Perfect, I believe. It's a white little jar. And they use, I believe, what's called vinefrine or something like that. It's French. I don't know. But it basically helps to brighten that hyperpigmentation in the skin. Apparently, women have been using it for centuries. It's actually derived from the sap of the grapevine. So in vineyards and stuff, obviously the pickers would go and get sap all over their hands. And when they would get home after, obviously, a full day of being outside, they wouldn't understand why their hands were so bright and their skin had so much hyperpigmentation. They decided that they were just going to put the sap on their face, and sure enough, it worked. So that product has that vinefrine in it, and that's really great because, again, if you have a little bit more of those sensitivities, you don't want to use something that's super harsh like that hydroquinone. It's a really good alternative to use. Doesn't give you any sun sensitivity, so it can actually give you that treatment benefit during day and night. With the Algenist, by the way, you can use this day and night as well. It's just I prefer using something a little bit stronger at night, just to really attack my hyperpigmentation. So again, vinefrine or the Totale is going to be more of a botanical-based brightener. Then after your treatment step, you want to make sure that you're treating your eyes as well. So whichever your concern is underneath the eye, you want to make sure that you have a really nice eye cream. I am currently using the Dior Capture Totale, and this one's really good for fine lines, wrinkles, firming, brightening, depuffing, a little bit of everything. I am in my mid-30s, so I do like to have some stuff that's a little bit more anti-aging, understandably. I just want to keep everything where it is, basically. So again, with the eye cream, just to make sure that we all know about technique and how to apply that, it goes on with your ring finger because you do have a lot less pressure in that finger, so you're less likely to tug and cause a little bit more aging on the skin, obviously counterproductive. So you want to make sure that you're just using a tapping motion all the way around your orbital bone. You don't want to go into your lash line because then you start getting the product into your eye, and if you're trying to do your makeup afterwards, that's going to be impossible with teary eyes. And then also you just don't want to make sure, you want to make sure that it's not going to give you any irritation because we are super sensitive on that lash line. Your skin, by the way, is a natural sponge, so that eye cream will absorb to where it needs to go, so you don't have to worry about that. So then your fourth step, is your moisturizer. This you would use AM and PM. You can use one with sunscreen for daytime, one without for night. I personally like to use the same one day and night. So it has a lot of anti-aging properties, So the one I usually use is this Kate Somerville Age Arrest. I really like this because of the texture. It's really moisturizing for my skin, but still not heavy, which is great, especially for this summertime. I am a little bit more on the drier side usually. In this particular kind of weather where it's a little bit more humid, I tend to be a little bit more combination. Obviously through my T-zone, I tend to be a little bit more oily and a little drier through my cheeks. So this is really a great product, a great moisturizer to use. Now, a lot of people will ask, well, why don't you do a moisturizer with an SPF and it's so much faster? What I say to that is I like my sunscreen to protect my skin, and I want it to just protect my skin. So that's super important. And then I want my moisturizer to just give me all that treatment. So I tend to just do a straight up moisturizer with treatment in it to give me the full effect of that anti-aging, of that treatment property of it. And then I'll do my sunscreen, so that's just protecting my skin and giving me the best protection possible. So speaking of protection, it's your sunscreen. It's going to be next, especially for daytime, obviously. Nighttime, not so much, because obviously there's no UV rays coming from the sun. Sun's not out. So what I like to use personally is Dr. Dennis Gross SPF 50 sunscreen. I don't know, it's kind of backwards there, if y'all can see that. Dark spot sun defense, broad spectrum, SPF 50. And what broad spectrum basically means is that it's going to give you UVA and UVB protection. UVA being aging rays, UVB being burning rays, yeah? So it's going to give you that anti-aging and that protection from burning on the skin. Now, I always say sunscreen is your best friend. Should be in your skin routine on a daily basis, every day out of the year. Even when it's overcast, even when it's rainy out, even when it's foggy out, even more so when really it's foggy and rainy out. Because what happens with light when it hits water, it gets magnified, right? We've all had that. You lay out by the pool, you get a lot more burnt than if you weren't, right? Common knowledge. So what basically this is going to do, it's going to protect your investment. If you're investing in treatments, if you're investing in anti-aging moisturizers, why not protect it? Protect your investment. You're spending some good cash on that. So use an SPF. I regularly suggest doing something that's going to be 30 and above. I don't go under a 50 myself. 90% of your aging comes from the sun, so you want to make sure that you're protecting the skin. Even if you're not doing any anti-aging, even if you're not, concerned with hyperpigmentation, this is going to be your best friend. There's only 3 things that you do in your skincare routine. It's cleanse your skin, wash your face, exfoliate, and use a moisturizer with SPF. All right, so that is the end. I hope you guys got something out of this. If you do have specific questions in particular to your concern or your skin type, please comment underneath. I'm happy to give you advice on any kind of skincare treatments or products that you can use over the counter. And yeah, I hope this is beneficial to you guys. See you guys later. Adios.